My name is Ron King. I'm a clinical specialist for TX Team. What I do as a clinical specialist is, 1, present-in services, 2, clinical supervision of physical therapy students, and 3, assist TX Team with bringing in nationally known presenters. I love treating patients. It's just, I've practiced for 18 years, and I still get juiced up, when I sit somebody down and I take their subjective complaint and try to figure out what's wrong with them and if I can help them or not. They've enabled me to teach, which I just love, and so it's nice to be able to take a class on over a given weekend and then come back and then share it like a month later and have people call you later and say, Ron, that worked. It's like, will you teach another one? And that's been really rewarding.
My name is Amy Wildridge, and I'm a Director of Rehab Services for TX Team. The thing I love about my job is that I get to work with a variety of individuals in a variety of different settings. I've been with TX Team for a little over 3 years, and one of the great things about our company is all of our associates are great team players. Everyone is willing to step in and step up when needed, even if it's an extra set of hands or maybe a little advice or guidance for a junior therapist on a complex patient. We have several senior therapists within the organization who are always willing to be a great resource and guidance to younger therapists. We always have therapists available on specific topics, always have therapists willing to travel and step in to any one of our teams when we need to, if we're short a therapist or when our caseload requires a couple sets of extra hands.
My name is Tammy Wilson. I'm the rehab aide for inpatient services at Johnson Memorial Hospital in Franklin, Indiana. I love old people. I really like geriatrics, and in a small rural hospital such as Johnson Memorial, there's a lot of elderly people in the community. I feel like we get a good salary for support staffs. Then we also have all the insurance benefits and the 401k that are also given to the professionals. They're available to the non-professionals as well. We also accrue time off, and that is a really nice benefit too, because that pays for our holidays and vacations and sick time and things like that.
One of the characteristics that typically appeals to candidates is our flexibility. And flexibility in terms of the daily schedule. Oftentimes, interested candidates will ask me during the interview process, well, what hours will I be asked to work? And our response to that is typically that as long as the responsibilities of this position are met, as long as the patient satisfaction is high and outcomes are good, you will be able to have a hand in setting that schedule. So some of our employees have families, and it may be that their spouse drops the children off in the morning and it's their job to pick them up at the end of the day. We allow them to adjust their schedule to make that happen. So they're allowed to begin their day a little earlier in order to finish their day on time and get to the children after work, or vice versa.
My name is Audrey Wilson Austin. I'm a certified occupational therapy assistant with TX Team. I also hold the position of Director of Occupational Therapy Services for South Carolina. The one thing that I enjoy about TX Team is the flexibility, the education, continuing education that's provided to the clinicians, as well as the systems and programs that we have in our facilities that allow the clinicians and patients to result in great outcomes in our buildings. Some of the systems include the fall management, dementia training, contractor management, and wound care, just to name a few of the systems that we provide in our buildings.
I'm Carol Nelligan. I'm the president of TX Team. I've been with the organization for 10 years. I began as a director of rehab services and have moved through a lot of different roles within the company. In a smaller company, you wear more hats. I've been the president for about 9 months now. And day to day, I do a lot of different things. My role is, I really feel, is that of a coach to keep this organization developing, to keep bringing the right people in to achieve our goals, and to not only continue to look strategically at our growth, but to also foster and create more value within the partnerships with our clients and with the associates that we have on board with us. I feel very enthusiastic about the fact that it would be a good choice for any associate, any therapist to come and grow with us. And I feel very passionate about the fact that we've really assumed a development role with our associates. Growing with us means that we're going to look at you as an individual, no matter how large we become, to be able to help you achieve your greatest potential, achieve that potential within you, whether your choice be clinical in developing those skills and working with your patients, or if it is more so in terms of a leadership track. If you have the possibility of becoming a leader within the organization, I think we'll look at you as an individual and give you the opportunities to develop those skills.
My name is Greg Jennings. I'm the owner of TX Team. The company was started in 1983. I graduated from Indiana University in 1976, worked for a company locally here for 7 years, and then started my own company and slowly have grown it to the size that it is today. I think the demand that we're going to be putting on healthcare is going to really change the delivery system, and I want to continue to stay on the cutting edge, providing those kinds of services that are going to be needed. In the teamwork that we have, we start out with them in the hospital. We work from there from a skilled nursing facility or an ARC if that's necessary, all the way into the home care program and then release to home. And every one of the people that works for TX Team's got to be very flexible in order to make that all work.
We are.
We are.
We are.
Nosotros somos.
We are TX Team.